Excuse me. Hi, everyone. Thanks for joining. We're going to get started in just a few minutes. I know, yawns are contagious. I'm gonna yawn again. Oh, goodness. Oh, stretch. Good morning. Good morning. Good morning. We'll give it about 2 to 3 more minutes. Hopefully, you're grabbing your healthy lunch or you're taking us for a walk. Looks nice outside. It's a little low. Let's see. Oh, I recently read that yawns are in part due to a need to cool down our brains. That's a cool fact. I think even saying yawns makes me want to yawn. Woo! Say that again. I've recently read, this is Leslie, put this in the chat. I've recently read that yawns are in part due to a need to cool down our brains. Very cool. I love fun facts. Give it 1 more minute. Feel free to type in the chat, introduce yourself. Tell us if you have any fun things going on in February. All right. Dr. Moy, are you ready?
Yeah.
Awesome. All right, we're going to go ahead and get started. So we can only see, hold on, oh, we can only see yours, not each other. Okay, gotcha. All right, Dr. Moy is sharing her screen. So we want to kick off by kind of putting January and February together in a way that makes sense. So if you were here in January, we kicked off our 2025 Wellness Wednesday webinars by focusing on building sustainable, healthy habits for the entire year. Our key takeaways included starting small and building onto your habits, being consistent and not skipping more than once or twice, tracking your habits, and designing a habit-friendly environment. So this February for National Heart Month, we're going to build on those takeaways as we take small steps to strengthen our heart, keep up with heart healthy habits, track our progress, create a heart healthy environment. We're going to build on these healthy habits by learning about heart health and heart-friendly practices. So I have the great pleasure of introducing Dr. Moy, who has 26 years of experience in primary care, previously serving as a partner at internal medicine practice before she joined CareFirst. Since 2020, Dr. Moy has been a medical director here. She's a passionate advocate for cardiovascular health. This is going to be her fifth year as a CareFirst health coach for the Heart Matters team. She has led community talks on cardiovascular prevention. She's presented on women and heart disease for the Women's Impact Network and participated in the clinical investigator talk with Dr. Lerner and Dr. Pomegrantz to discuss heart disease research and prevention. So, Dr. Moy, I'll let you take it away.
Thank you very much for that nice intro, Katie. And thank you, everyone, for letting me be here today to talk to you about cardiovascular health. So as mentioned, February is the month that is known as the American Heart Month. And why is that, do you suppose? Is it because Valentine's Day is in February? Could be, but actually it's because cardiovascular disease is so very important as a topic. It's the #1 killer in the United States. So it's worth spending some time on. So what is it that the heart wants, as the title of the talk is? Aside from wanting to love and be loved, it wants to matter. It wants to matter to you, and it wants to stay as healthy as possible. Hopefully today, my goal is to get you to see that the heart does matter and to give you some tools in your hands so that you can do something about it. As far as the talk goes, we're going to cover these areas here. We're going to talk about what cardiovascular disease is. Then we're going to catch up on what can we do as far as risk factors and causes to try to avoid having cardiovascular disease. Then about some treatments and cardiac rehab. And then Katie's going to talk to us about some wonderful CareFirst resources that we have that can help us improve. So I'm going to start first with this slide. This is a photograph of my father and my daughter, Samantha. My father came to this country when he was 16 years old. At that time, he didn't know any English, but he was determined to give his family a better life. So he worked really hard, actually made it through high school, miraculously got into college, but didn't have the money, so couldn't go. So he was still very determined to try to give his family a better life. So he got a job at the Washington Post working as a printer. And he worked double shifts. He worked double shifts during not just the week, but on the weekends. He skipped eating regularly, ate a lot of fast food, didn't exercise, missed out on a lot of sleep, but he was making us his priority. He managed to make time to spend with us, despite how busy he was. But the thing he did not do was he didn't make himself a priority. And because of his bad habits, he developed cardiovascular disease, and he missed out on spending quite a few years at the end because, it affected his health. So my take-home point from this, and the reason why this is my passion, is that I want people to know that, yes, absolutely, your career is very important. Your family is extremely important, your friends, your hobbies. And I'm sure there are a lot of things that are really important, but your health is also very important. And it's something where your kids and grandkids are going to want to spend time with you for as long as they possibly can have you. And so we need to be able to live healthier and live longer. So let's talk a little bit more about cardiovascular disease then. Cardiovascular disease is a group of disorders that involve the heart and the blood vessels of the body. There are 4 major types. There's the stroke, the coronary artery disease, congestive heart failure, and arrhythmias. 1 in 5 people in the United States will die from heart disease. It has been the #1 killer in the United States every year for over 100 years now. So that's just to give you an idea of the importance. So let's start out with strokes. What exactly is a stroke? A stroke is when you have brain damage that happens when brain tissue dies. And there's a couple different kinds of strokes. We're going to start out with the so-called mini stroke, otherwise known as the TIA, or the transient ischemic attack. And this is actually not a true stroke because there's no absolute permanent brain damage. What happens is you have blood flow disturbance. So that causes your body to act as if it's having a stroke. But the good news is that it actually resolves completely within 24 hours. But this is something that is a red flag because 1 in 3 people who have a TIA will eventually get a stroke. And the 48 hours following a TIA is probably the most important as far as having a stroke. Now, for real strokes, there are 2 types. One is the ischemic stroke. And what happens with that is that you've got blood vessels like here, they get all junked up and start closing up. It affects your blood flow to the brain. And because of that, you don't get enough oxygen supply and your brain cells die. So that's the ischemic stroke, and that's the most common kind of stroke. You can also have a hemorrhagic stroke, which is where you bleed into the brain, and it's the blood that causes your brain tissue to be damaged. So those are the 2 major types of strokes. Now, the thing to remember about strokes is that they can be so mild where you don't even know that you've had a stroke, but someone will get your CAT scan of your brain for another reason, and they'll see that you've had a stroke. Other people can have a massive stroke and they can die from it. So there's a huge range for it. So what is this FAST and why should you learn to recognize it? FAST is an acronym that was developed to help people recognize, when a stroke was happening. So F stands for face. A lot of times you can see droopiness happening on one side. It just doesn't look symmetric. That should give you an inclination that maybe there's a stroke in progress. A stands for arms. If you can lift one arm but not the other, or they're not as equal as they usually are, that is another sign that you could be in the middle of having a stroke. S stands for speech. If your speech is slurred or garbled, or if you just can't understand someone else when they're talking, those are signs of stroke. T is the most important. T stands for time. So if you're in the middle of having one of these other symptoms, you don't have time. Call 911, get an ambulance, go to the hospital as quickly as possible. Do not wait to see whether it will go away after an hour or 2. Don't wait for your family to come home so they can give you a ride to the emergency room. And the reason why is because if you're able to make it to the emergency room within 3 hours, there are medications that are available that can stop that stroke that's happening. If you don't make it within the 3-hour window, then you won't be able to get the medicine. Coronary artery disease is the most common form of cardiovascular disease. And this has to do with the blood vessels that supply the heart. It involves also something called angina, which is similar to the TIAs. It's a red flag, and it has to do with interrupted blood flow to heart cells. But once again, you don't have official damage to the heart cells, so it's not a full-blown heart attack. There are 3 different types of coronary artery disease. The most common is obstructive coronary artery disease. And if you look at this blood vessel here, you can see there's a lot of buildup, cholesterol. And what happens is you're interrupting adequate blood flow to the heart muscle. And if it doesn't get enough oxygen, then heart cells die, and that's a heart attack. A lot of times people think that, hey, I have clean coronary arteries, I'm okay. That's not necessarily true. There's something called non-obstructive coronary artery disease, and that can happen from spasming of the blood vessel. So the blood vessel can close up due to spasm, and that will also interfere with blood flow. If it happens long enough, your heart cells will still die. Sometimes you can have microvascular dysfunction, which is where it's not the big coronary artery disease we normally think about that are in trouble. It's the small ones that lead up to the big one. And that can also cause you to not get adequate flow to your heart. There's something called myocardial bridging, where you can have heart cells muscle that is next to the coronary arteries, and these muscles press on the blood vessels and cause it to close up. And then that interferes with blood flow. Spontaneous dissection, the last one here, is probably the most rare and hardest to diagnose. And what happens with that is that the blood vessels have a wall, and you can have the wall split, and the blood can actually flow inside the wall, and that causes an interruption in blood flow as well. So those are the main types of coronary artery disease. Now, you should know that for women, there's a special consideration here. Women have estrogen, and estrogen is a great thing because it causes your blood vessels not to be so sticky. So cholesterol has a harder time building up inside the coronary arteries. It also relaxes the muscle walls, so that keeps things open and flowing. So women are lucky because they can delay development of coronary artery disease by up to about 10 years compared to men. But unfortunately, there comes a time where we reach menopause. That's about 10 years down the line. And this is what causes us to catch up, with the men. So how do we know if someone's having a heart attack? A lot of times we kind of visualize the movies. You've got this middle-aged guy clutching his chest from chest pain and falling to the ground. And that's your classical heart attack. Couple things to know about that. Chest pain is the number one symptom to know about. But when we say chest pain, we're not just referring to pain as we normally think about it. It can also refer to chest tightness, chest pressure, chest burning, chest heaviness. All of that counts as chest pain. And men and women, once again, are a little bit different. Women tend to experience heart problems or angina a little bit differently. And when they present with heart attacks, it's sometimes harder to pick up because their symptoms are not as classic. And sometimes they don't even have chest pain. But some of the common symptoms that they sometimes have include upper body pain, like your shoulders, your arms will bother you, or nausea, you feel like you're going to throw up, or you feel like you can't breathe, you've got shortness of breath. Sometimes you can break out into a cold, clammy sweat. You can feel really dizzy, like you're going to pass out, or you can just feel really tired for no good reason. And don't get me wrong, the men can also experience heart attacks with those similar type symptoms, but the atypical ones happen more often with women. So it's good for you to know about them. Congestive heart failure is another type of cardiovascular disease. With congestive heart failure, the body has a hard time pushing out enough blood. The heart has a hard time pushing out enough blood. So what happens is the blood winds up backing up, and it winds up first in your lungs. So you have problems breathing. Then it goes and backs up into your legs, so they swell up, and then to your feet, so they swell up too. The most common cause of congestive heart failure is coronary artery disease. But things like blood pressure, diabetes, alcohol abuse can also cause congestive heart failure. And there's two main types. There's the diastolic and the systolic. So here we have a picture. In the middle here is what a normal heart would look like. On the right here, we have what a person's heart would look like if they had diastolic congestive heart failure. If you look here at the muscle, this wall of the cardiac chamber here, this is normal. And then this is what you see. It's very big and overgrown with a diastolic dysfunction. So what happens is your pump is actually good. It works fine. But because your muscle is big, you actually don't have as much room in the chamber. So compared to your normal heart, there's less blood coming in. And if you have less blood coming in, that means there's less blood going out. And that's the problem with a diastolic dysfunction. It can't keep up because it can't get enough blood in. With a systolic dysfunction, you actually can see that the muscle here for the chamber of the heart is thin, and this chamber itself is very big. So you basically have a big floppy heart. The pump doesn't work. You can get the blood in, you just can't make it go out the way that it should. So those are the two major types of congestive heart failure. Arrhythmias is the last major category for cardiovascular disease. Arrhythmias just refer to the rhythm of the heart not being normal. The top strip here is what your normal EKG strip looks like. You can see that the rhythm is very normal, very regular. You've got the nice waves you normally see, the P, the QRS, and the T, as far as what you expect to see. The second one here, I put this one on because this is very, very common. If you don't know someone with atrial fibrillation, which is what this is, I'd be surprised. But basically, you can see the rhythm here is very irregular, and you don't have all the waves that you're supposed to. And then the last one I want to touch on is the ventricular fibrillation, mainly because that's the really dangerous one. That's the one that you can get sudden death from and die, die suddenly. Okay, so let's talk a little bit about risk factors and the causes of cardiovascular disease. So whether or not you develop any kind of disease depends on a couple of different things. Usually we talk about genetics. Were you born with it or born with a predisposition? Or have you made some bad choices as far as, how you've been living your life? Or is it, fate or just bad luck as far as whether you develop a certain disease? So with cardiovascular disease, what percentage do you think is under your control? So we're talking 20%, 40%, 50%, 65%, 80%. I'll let you guys think about that and decide. Okay. So the answer is 80% of your risk is under your control. So that's wonderful news, because if you think about it, don't forget cardiovascular disease has been the number one killer every single year for over 100 years. And you have the 80% control over whether you die from cardiovascular disease or not. So that is really good news. What we're going to do is we're going to talk about the risks that you have no control over, but you should be aware of, because that may motivate you to work harder at it, go see your doctor, talk to them about it. And then we're going to cover the ones that you do have control over. Things that you don't have control over include your age. The older you are, the more time you've had to clog up your blood vessels, and the blood vessels tend to be stiffer. So you tend to have more issues, with your heart. Your race or ethnicity is important. If you're Afro-American, if you are an Alaskan Native, if you're a Native American, you have a higher chance of developing cardiovascular disease. That being said, regardless of race, cardiovascular disease is still the number one problem. Your family history. If you have a father or a brother who developed their first heart attack when they were 55 years old or younger, that means you have a genetic predisposition. Now, if you have a mother or sister who developed heart disease when they were 60, sorry, you still have a genetic predisposition because remember, estrogen buys you 10 years. So if your mother or sister has had a heart attack and they were under 65, you actually still have a genetic predisposition there. Hormones. So hormones we touched on a little bit with the estrogen. A lot of times people will react and say, well, you know, if it's estrogen that protects me, can't I just take hormone replacement therapy when I hit menopause? And it's actually a lot more complicated than that. It used to be in the old days, they said, yes, you know, this is God's gift to women, go ahead and do it. Then they realized that no, maybe women were having more heart attacks, you know, on the HRT. And then they found that if you took it early on, you were less likely to have problems, but it was more of a problem if you started the HRT later, like 10 years after menopause. But now currently they're starting to say that maybe it doesn't make that much of a difference either way. And then the last one here we have is the high CRP. C-reactive protein is an inflammatory kind of protein. It's present more in Afro-Americans and also in Hispanics. It's something where if you have several different CRP readings and they're high, you can actually have 2 to 3 times a higher rate of having a heart attack compared to someone with normal CRP. So let's go to the more fun part here. This is the part where you do have control over it. So let's talk about obesity. Obesity has to do with how much adipose tissue, how much fat tissue you have basically. And one of the ways they look at it is at something called the BMI, the body mass index. And that is something that's calculated by looking at your weight and looking at how tall you are. The problem with a BMI, and let's talk about what's normal, what's not. Normal BMI is 25. Obesity is technically 30, unless if you're Asian, in which case it's actually 27.5. So with the BMI, you have to remember that muscle weighs more than fat. So if you look at this picture here, if you see this guy here, he's all muscular, and this guy here, he's not. So if both of these guys are the same height and the same weight, do you think they're going to have the same risks? No, they're not. So BMI is not the be all end all number to be looking at. You have to factor in, you know, what's your body composition, you know, among other things. They also look at the waist. For women, if your waist is over 35 inches, that's obesity. For men, if it's over 40 inches, that's obesity. And the reason why this is important is because they're actually focused on your visceral gut, your visceral fat tissue, your belly fat. The reason why that's important is because belly fat makes something called cytokines, which are inflammatory, and they actually can affect the structure of your heart. They can increase the atherosclerosis that your blood vessels develop. So it increases, if you have a lot of belly fat, that actually makes it more likely that you'll have heart disease and a heart attack. So say if your BMI is 40, is it hopeless? Is it something where no matter what you do, it's not going to make a difference? No, it actually makes a difference. If you are able to lose 5 to 10% of your body weight, that's good. It'll actually help improve your blood pressure and it will help cut your risk for heart disease, cardiovascular disease. So if you're sitting there and you're like, well, hey, my BMI is perfect. I don't have a weight problem. And for that matter, I don't have diabetes. I don't have cholesterol problems. And, you know, but you like to watch a lot of television, or maybe you like to surf the net or do Instagram or, you know, whatever, but you're not active. Are you still at risk? Why, yes, you still are at risk. And as a matter of fact, it's felt that Your inactivity accounts for 35% of your risk for coronary artery disease and for morbidity and mortality related to the heart. According to the CDC, they've set guidelines, and 28% of Americans are actually not reaching those guidelines. So how much activity do you need? You need 150 minutes every week of a moderate level type, exercise. And it doesn't have to be done any particular pattern. You can exercise 5 days a week, 3 days a week, so long as your total is 150. So if you're a super busy person and you just don't have time for 150 minutes, what are your options? Well, you can actually choose to do vigorous exercise, which only requires you to do 75 minutes a week, which is half. So that's great. So what exactly is vigorous versus moderate exercise? Moderate exercise, if you generally think about it like you can't sing, but you can talk, while you're doing the exercise. That's more like moderate. If you're doing vigorous exercise, you can't probably carry on a good conversation, maybe a word here and there, but nothing major. So that kind of gives you a rough guideline as far as what the exercise is. So blood pressure. And blood pressure is very, very common and it's silent. Most people who have high blood pressure, they have no idea, they can't feel it. So a lot of times you can get fooled into thinking that it's not that big a deal. Everybody has it and you feel fine. So let's talk about blood pressure a little bit more. Usually there's two numbers to your blood pressure reading. For example, like 120/80. 120 is the top number, it's higher, and it corresponds with when your heart is pumping your blood out to your body. Your heart squeezes and is forcing the blood out to under pressure. That's related to the top number for your blood pressure reading. Then the heart relaxes because it has to fill up again, with blood. So when it's relaxed, the pressure goes down, and that's your second reading for your blood pressure. So if your blood pressure is actually 170/100, and instead of 120/80, then every single time your heart pumps, it's sending blood out at a higher reading. How many times does your heart beat a minute? Maybe about 70 on average. That means every day it beats over 100,000 times, um, uh, and all at a higher reading, higher pressure. And for a year, that's like 37 million times almost. So if you imagine forcing blood out at a higher rate to your entire body, where it's hitting your brain, it's hitting your eyes, it's hitting your pelvic organs, your kidneys, your heart. Think about the amount of wear and tear that is over time. And you can kind of imagine the damage that gets done with high blood pressure. You can get kidney failure. You can get sexual dysfunction. You can, increase your risk for stroke, all sorts of things. How can we lower your blood pressure? Salt is a big one. Normally, they recommend that you have 2,300 milligrams of salt or less per day. Most Americans have 3,400 milligrams. If you have high blood pressure, you need to cut that down, the average down to maybe about 1,500 milligrams, 1,200 milligrams. It would be better. The lower your salt intake, the better your blood pressure tends to be. You can eat potassium or foods with potassium. That tends to lower your salt and also lower your blood pressure as well. Potassium-rich foods include things like oranges, bananas, avocados, tomatoes, salmon. But be careful because some people cannot eat too much potassium for health reasons, like if you have kidney disease or something like that. So just check with your doctor before you do that. If you lose weight, stop smoking. Smoking has nicotine, which raises your blood pressure. Stop alcohol. That all tends to also decrease your blood pressure. So, how much do you need to decrease your blood pressure to have a significant difference? If you drop your blood pressure by 10 points, that can cut your risk for a major cardiovascular event by about 20%. This is according to a 2022 meta-analysis by Current Cardiology. And for those of you who are highly motivated and you want to take your blood pressure reading at home, I'm just going to touch a little bit on how to take it properly. A lot of times people don't know, and even when you go to the doctor's office, a lot of times they don't do it quite perfectly there either. But you want to make sure that you are in a quiet space. You don't want to have just had caffeine. You don't want to have just exercise. You don't want to be watching the news. You don't want to be looking at your phone. So you need to be wearing loose, comfortable clothes. You want to go to the bathroom, first. You want to sit so that your feet are uncrossed and flat on the floor. You want the level of your cuff to be at the same level as your heart. And you want to not be talking to anybody. And then after about 5 minutes, go ahead and take your blood pressure. And if your blood pressure is high, don't get scared. You can just recheck it a few days later or even 10 minutes later, and see what the trend is. And if the trend tends to be high, in other words, 140/90 or more, you may want to let your doctor know what's going on. And diabetes. 2 out of 3 people with type 2 diabetes will die of heart disease. I'm going to say that again. 2 out of 3 people with diabetes will die from heart disease. Why is that? Well, if you have sugar in your system, high levels of sugar, it actually affects your blood vessels. So it can cause an increased risk of atherosclerosis and blockage, to happen. So 28% of people who have diabetes don't even know that they have it. So the first thing you need to do is when you're seeing your doctor, get a physical if you haven't been getting physicals regularly, or at least get your blood work checked to see what your sugars are running, because that's important. The way that diabetes normally is treated is they actually have you do low carb diets, exercise, weight loss, and medication if it's necessary. Cholesterol definitely can have a big impact. And we normally talk about 2 types of cholesterol. There are more, but the HDL is your good, the LDL is your bad. You can remember that because H in the HDL high. You want your HDL to be high and you want your LDL to be low. LDL causes your blood vessels to clog up. HDL actually does the opposite. So this is something where it's important. And a lot of times people are like, well, you're looking at your steak and, you don't have it that often, maybe a couple times a week. And then on top of that, you want your eggs or your fried chicken or what have you, because you need a reward. It tastes good. And because you don't feel it, you're like, why should you be concerned about it? So just kind of picture this. If you are pouring grease down a kitchen sink, nothing's going to happen right away, but there will reach a point where everything clogs up and then you've got a royal mess on your hands. So the best way to approach it is actually to prevent it in the first place. And this is how we're going to prevent it. You're going to look at the foods that you are eating. There's 2 ways. Well, there's probably more than that, but there's two major ways you can do it. If you're a picture-oriented kind of person, you want to keep it simple and easy and not have to do too much work. Just look at the group of foods, common foods that are high in cholesterol. Then look at the groups of foods that are good for you and will help lower your cholesterol. And pick something. Like, for example, I see a donut here. Say you love donuts. Just eliminate that. Pick one thing, just eliminate that and substitute it with something else from the good category, like strawberries. And then just work on that a little bit at a time. So it's not that hard. And you can work it gradually over time and you'll eventually, get there. The other way you can do it is if you are someone who are highly motivated, when you go grocery shopping, check out the labels. You want to reduce saturated fats. These are bad for you. We're talking about whole dairy products and red meats usually. They tend to raise your LDL level. You want to eliminate your trans fats if you can. The trans fats are more associated with processed foods that can include like cookies, crackers, baked goods, microwave popcorn. So those actually, the trans fats can raise your LDL and lower your HDL. If you eat foods that are high in omega-3s, like salmon, mackerel, walnuts, those tend to lower your triglycerides and increase your HDL. If you increase the amount of fiber that you take in, like say if you have oatmeal or you have Brussels sprouts, that actually will decrease how much cholesterol gets involved, it gets absorbed in the first place. Now, there are other ways that you can impact your cholesterol, and that can include exercise. Exercise raises your good cholesterol, the HDL. If you quit smoking, that also raises your HDL. Losing weight, watching your alcohol, that tends to help. So let's talk about smoking. Smoking can actually increase your risk of having heart problems by about 2 to 4 times compared to someone who doesn't smoke. It can increase your risk for stroke by 2 times. And for people who think that vaping is okay, not so okay. You still have the problems. And that's because nicotine is in both regular smoking and in vaping. And that can cause high blood pressure and can cause problems with your blood vessels. Um, Now, if you are 20 years old and you're thinking, well, I can get away with this and I'll just worry about it later, just be aware that even if you're 20 years old and you're smoking, it will already be increasing and accelerating development of heart disease and damaging your blood vessels. Um, Women, just a comment about that. For women who smoke, it's extra bad compared to men. Women and men who are over age 35, more women will die than men if they smoke and they're over age 35. So that's something for you to know about. So, what if you decide you're going to stop smoking? Is it worth it? Absolutely, it's worth it because if you stop smoking, and you've stopped smoking for a year, you can cut your risk for developing cardiovascular disease by 50%. By year 15, you have cut it down to the level of someone who's not smoked. So, yes, absolutely, it will make a difference. Let's talk about alcohol a little bit. I do want to touch on the red wine myth as it relates to alcohol. A lot of people think that if they drink red wine, it will protect their heart. And that is not true, but it's confusing. So I'm going to talk to you about, what actually was meant by the original comments on this. So red wine does have antioxidants, and theoretically, antioxidants are good for you. And there are studies that show that people who drink some red wine are associated, that this is associated with a lower level of cardiovascular disease. The key, though, is that they've tried to show cause and effect. In other words, that drinking the wine actually will cause you to have lower levels of cardiovascular disease. And they've never been able to show that. So that is the reason why there are no dietary recommendations saying that you should include alcohol in your diet. And the other thing is there's been actually a lot of information out recently which have pointed to more health risk with alcohol. The US General has looked at putting on labels of warning for alcoholic products, noting that there is an increased risk for cancer. It's been associated with 7 different cancers, and that has been shown to have cause and effect. The other thing is alcohol can cause damage to your heart. If you remember with the congestive heart failure and the systolic heart, the big floppy heart. Alcohol can weaken your heart muscles. It can cause irregular heart rhythms. It can cause, problems. Originally, they had said that if you are a woman, you can get away with 1 drink a day. If you're a guy, less than two is okay. They're stepping back from that. They're starting to say that the less you drink, the better. And in this little picture here, we talk about what exactly is 1 drink, because a lot of times people don't know, well, what does that mean? So this shows you that, yeah, actually beer does count, because a lot of times people think beer doesn't. It's not real alcohol. Wine, 4 ounces is how much we're talking about. And so you can see that, what these values are. Stress and heart health. Um, Stress can definitely cause problems. A little bit of stress is good. Chronic stress is not. Stress can increase your risk for heart attacks and stroke, and it can raise your blood pressure. And it's not a big surprise, because when you're stressed, what do? A lot of people smoke, a lot of people eat, a lot of people stop exercising, all the things that we know are not good. So it can do that. Now, sometimes you can have periods of excruciating stress. And some of you may have heard about the broken heart syndrome. It's a real thing. You can actually cause some damage to the heart just from having acute, extreme episodes of stress. A lot of times people don't know, though, that depression is also a big problem. Women have depression a lot more than men do. And what happens is, if you're under age 55 and you have developed depression, you actually have double the risk of a heart attack at a later age. And if you were to have a heart attack, you tend to have a harder time recovering from it. So depression, if it's treated, though, does not seem to have similar issues. So this is something where it's a real problem. So let's talk about treatments. What can you do? What should you do about, about all of this we just talked about? And so there are procedures that can be done to help open up blood vessels. Angioplasty, which includes like the balloon to dilate the blood vessel to increase blood flow, stenting, bypass surgery. There are a lot of medications that are out there. The one that I want to talk about particularly is cardiac rehab. The reason is because a lot of people qualify for cardiac rehab and they don't get it, because sometimes the doctors even don't remember to recommend it. If you have had any of these conditions, if you've had a recent heart attack, if you've had the balloon angioplasty done, if you had bypass surgery recently, if you have chronic stable angina, chronic stable heart failure, if you've had a heart transplant or a heart valve type issue, all of this will qualify you to get cardiac rehab. Medicare will cover 36 sessions. Only 20% of people who qualify are actually getting it. They have shown that for people who do cardiac rehab, 45%, there is a 45% drop in all-cause mortality at 15 years. And they do show that people who do it actually have increased exercise performance, better cholesterol, better blood pressure. They can do more in terms of daily activities. They feel better. Their stress, depression, all that is better. So something that's worthwhile to remember. So I'm going to go ahead and share a story. This is Susan Ostriger's story. She is a CareFirst appeals nurse who has been through all of this on a very personal level. And she was nice enough to want to share her experience so that you can understand from the real life perspective, what it's like. So let me go ahead and show this.
Susan Ostrager. Today, I am not going to be talking from the perspective of a clinician, but I'm going to be talking from the perspective of a patient. It's really exciting for me to be able to share this story with you. So 53 was a really significant number in my life. At 53, my mom died from lung cancer. Now, you might think this is morbid, but I set a goal for myself at that time, and my goal was to live past 53. But in August of 2017, when I was 53, my life started to get ready to change. And at 53, I started my workup for chest pain. To look at me, you probably would not have thought that I was a cardiac patient. My weight was normal, maybe the upper limits of normal, but by no means was I considered obese. Blood pressure was okay, maybe borderline, but I wasn't medicated at the time. My cholesterol would go up and down, depending on my diet. I exercise occasionally, not every day, but sometimes. Now, I'm not proud to tell you that I was having a really unhealthy relationship with three men, Ben, Jerry, and Orville Redenbacher. But looks can be really deceiving. Beginning in my 20s, I started to have chest pain that was really right in my sternum, and it was very sharp, and it would travel up and down, and it was intermittent and sporadic, usually related to stress. And a good swig of Mylanta or Gaviscon would take care of it. It was never associated with any other symptoms. There was no sweating, no dizziness, no nausea, no shortness of breath. But at this point, at 53, the pain started becoming more severe and more frequent. So I went to my PCP, and that's where the workup started. So I had an EKG, I had an exercise stress test, I had a nuclear stress test, I had an echocardiogram, I had a calcium score, I had GI workup, I had an EGD, and I had a cardiology consult. And the consensus was from both my gastroenterologist and my cardiologist that this was really unlikely related to anything that was cardiac, and no further workup would be warranted. And they thought that maybe this was just GERD or esophageal spasm, like I had believed all along. But by New Year's weekend, the intensity started to become really unbearable. And by New Year's Day, the pain was like off the charts. I was out walking my dog, my 82-pound Labrador Retriever, because I had to. And the pain was continuing, and I started to get really nauseous, and then my stomach started getting really gurgly, and I thought I was going to be incontinent. And I was just like praying, that we just get home, which fortunately I did, at which point I vomited and had diarrhea. And then I knew something wasn't quite right. So I went ahead and called 911 to get treatment for this esophageal spasm. In the ambulance, EKG showed that I was having a heart attack. Surprise. An EMT couldn't give me any nitro because my blood pressure was low. He couldn't get an IV started. So all I got on the way to the hospital was a handful of baby aspirin to chew up. In the ER, fortunately, I was still there, and they were able to get the IV in, and they started to give me nitro and IV morphine, none of which would take the pain away. Didn't even take the edge off the pain. And at this point, the pain wasn't only in my sternum, it was all over my chest, it was in my jaws, it was in my arms, in my fingertips. It was just unbelievable. So the doctors called the interventional cardiologist, and off I went to the cath lab. I was prepped and sedated. I can't remember much from this time in the cath lab, but I can remember starting to wake up, and I heard a lot of people rustling around, and I heard something about paddles. And then I started clearing my throat a lot and pumping a little bit. And I can remember telling the staff in the cath lab that it was just my postnasal drip. But it wasn't my postnasal drip, it was flash pulmonary edema. So a lot of diuretics and intracardiac nitro and who knows what else I was given. They were able to stabilize me, and I was taken off to the ICU. When I got to the ICU, I had learned that my left anterior descending artery, my LAD, was 100% occluded. I had a stent, and I had an intra-aortic balloon pump. I have no idea how long that artery was I mean, this was hours. I think my walk with the dog was somewhere around 11 or 12, and it was evening when I got back from the cath labs. It was hours that artery was occluded. Learning all this, I was so terrified and became really, really depressed. And of course, my mind went to all the worst places. That's my nature for my mind to just go all the worst case scenarios. All I could think about was if I'd be an invalid, how would I walk my dog, how would I go grocery shopping, who was going to shovel my snow for me, how was I going to take care of myself? And I just continued to cry and cry. So here's a cute story real quick. I was so sad that the staff in the ICU really didn't know what to say to me or do for me anymore to help me. So the nurse had pulled my son aside, who's in the picture, and sent him home to get the dog. And the dog came back into the ICU, and they stuck their head in the door and said, "Susan, we have a visitor," and there was Toby. So that was the first smile that I had in the whole time that I was in the hospital. I spent 2 nights in the ICU and 1 night on telemetry. I was discharged on day 3, which was I guess pretty much standard, and repeat echo was done, and my ejection fraction was only 35 to 45%. So that was pretty depressing right there. At home, I had 6 weeks to recover and then started cardiac rehab. And I need to tell you that the cardiac rehab was, to me, so invaluable. The utter fear of another event was so significant that I never would have exercised on my own at home for fear of collapsing on my floor. But when I was at cardiac rehab and I was connected with my leads and my telemetry, I felt safe. At my 4-month follow-up with my cardiologist, they did another echo, and my ejection fraction went up to 55 to 60%. So I don't know. I'm thinking that's pretty remarkable. So finally, I felt like I was able to live again, and I was given a second chance at life. And there's not a day that goes by that I don't remember the event and remember how grateful I am. I hope this somehow touched somebody today and will make a difference in someone's life. Thanks.
So once again, thank you so much for letting me speak to you about such an important topic. And I hope that this helped you understand a little better, learn something, and help with keeping you healthy and the people that you love healthy. If you get a chance, join a heart walk team. I tell you, it's fun and it feels really good to make a difference. And don't forget to wear red on Friday to remember heart health. And now Katie's going to talk to us about some resources.
Awesome. Thank you so much, Dr. Moy. What an educational and informational session. Our CareFirst resources, if you want to go to the next slide, just a reminder that we have discussed setting up healthy habits and heart health so far this year. Next month, we are going to discuss nutrition and how food choices elevate all areas of our health. I hope you can see that all these topics are interconnected. Habits that we build today will lay the foundation for better health tomorrow. Smarter nutrition choices and an overall healthier you in 2025 is the goal, and we're excited to continue this journey on together. For CareFirst Wellbeing, if you do have access, just a reminder that this is our wellness program provided to you, included in your benefits with a ton of resources that are customized to your interests and to your needs, including the Real Age test, a personalized timeline, tracking capabilities, ongoing challenges to keep you engaged, health profiles, and then our core programs. Some of our core programs being health coaching, we have lifestyle management and disease management. We offer 2 weight management and diabetes prevention programs called Noom and Eat Right Now. We have a Craving to Quit tobacco cessation program, a Smart Dollar financial well-being program, and then we have a cost saving program, of Blue 365. And last but not least, whether you want to understand your insurance plan better, or you want to explore care options or find health tips and wellness tools, our CareFirst resources are here to support you. And then just want to thank you so, so much for your time today. Thank you to Dr. Moy for that amazing presentation. Thanks everyone for joining and for prioritizing your health and well-being. And we can't wait to see you back in March for nutrition. Thanks, everybody.